Good morning, my name is Rob. I'm one of the cardiac rehab supervisors here at Toronto Rehab, and today I'm going to be talking to you about cardiovascular warm-up and cool-down. Hopefully by the end of today's session, you'll understand why it's important to carry out a proper cardiovascular warm-up before you do your exercise prescription, a cool-down afterwards, and also understand how to go about doing a good warm-up and cool-down. So, why do a warm-up? Quite simply, the purpose of a warm-up is to gradually prepare the body for exercise. For optimum physical performance, you always want to make sure that you do a warm-up before any kind of physical activity. And for heart patients, you also want to make sure you do a warm-up because there are some safety issues associated with neglecting your warm-up before you carry out your exercise prescription. So if you do a proper warm-up, there are a few physiological things that will happen in your body. Key one is your blood vessels will dilate, they'll get a little bit bigger, and that will result in increased blood flow. Blood carries oxygen, so blood and oxygen flow to the working muscles where they're needed, including your heart. Your heart rate will also increase gradually. Your blood pressure will increase gradually as well, and your respiration, the rate at which you breathe, will slowly pick up. These are all normal responses, and that's what we like to see anytime someone's going to start doing their exercise prescription. If you do a proper cardiovascular warm-up, there are a number of benefits that you'll derive from doing so. The key one, most important, is it decreases the incidences of any angina or chest pain that you might have, especially if you have coronary artery disease, which are limiting the flow of blood in your coronary arteries. Decrease the odds of having any arrhythmias or skipped beats. Decrease the odds of having silent blood flow problems, what they call silent ischemia. Decrease lightheadedness or dizziness. Decrease the incidence of shortness of breath, and your walk generally will feel much easier and much better if you've done a proper cardiovascular warm-up. This is an example of a patient that we had on the program who started with us, and he would complain of angina or chest pain pretty much every time he went out to do his exercise prescription. So we brought him into the center and we hooked him up to our telemetry units, which is an electrocardiogram, so we can measure his heart rate, measure his cardiogram while he's carrying out his activity. We hooked him up and we found out that his heart rate was 56 beats per minute at rest and his ECG was perfectly normal. Now, we can get an awful lot of information from our cardiogram. Of particular interest to us here at the center is your blood flow. We look at a part of the cardiogram that is called the ST segment. And on this ECG that you see on the screen, the arrow is pointing to the ST segment. Ideally, that line comes out of the big spike at the same level that it goes in. And if we see that, typically that implies you've got no blood flow problems. So this person came in, was hooked up, and then we suggested that he go out and carry out his usual exercise prescription. So he stepped out onto the track and didn't do a cardiovascular warm-up at all. His exercise prescription asked him to carry out a 16-minute mile walking prescription, so he started off with that. Sure enough, 2 laps into his walk, he starts complaining about his usual chest pain. So we take a look at his cardiogram and we notice a couple of things. One, his heart rate has increased, which is what we'd expect. It had increased to 95 beats per minute. But the cardiogram itself has changed dramatically. If we take a look at the part of the ECG that deals with blood flow, the ST segment, highlighted here by the orange arrow, you can see that the ST segment is coming out of the big spike a lot lower than it's going in. This is what we call ST segment depression. When we see ST segment depression, typically it's an indicator that there's a blood flow problem. Blood flow problems a lot of the time cause angina. So we can see why this particular patient is getting his angina. He's got blood flow problems with his exercise. So we had this patient stop his exercise, come into the telemetry room, sit down and relax. He did that, his ECG returned to normal, his angina went away, and his heart rate came back down to resting levels. We then told him to do a proper cardiovascular warm-up. He did the proper cardiovascular warm-up, then increased to a 16-minute mile pace, and here is his ECG then. And you can see that the ST segment, once again indicated by that arrow, is coming out of the big spike at the same level that it's going in. Once again, when we see that, that indicates that this person's not having any blood flow problems, and consequently, this patient had no angina with his exercise. The only difference, the only thing we did, is we told him to do a proper cardiovascular warm-up, which gave his coronary arteries a chance to dilate, get much bigger, increase the supply of oxygen-rich blood to the heart, and because he was able to do that, he didn't have any further problems with angina. So I think we can all understand that it's important to do a cardiovascular warm-up. How do we do it? It's very simple. To do a proper cardiovascular warm-up, all we ask you to do is to walk for 5 minutes at a speed slightly slower than your usual walking pace. By slightly slower, we usually recommend that you walk roughly 2 minutes per mile slower than your regular pace. A mile in 16 minutes, we'd want you to warm up at an 18-minute mile pace. Do that for 5 minutes. The vast majority of people can make all the physiological changes in their body within 5 minutes. The heart rate will increase adequately, so will the blood pressure, so will their respiration, and very importantly, their coronary arteries within 5 minutes can dilate adequately to increase the supply of oxygen-rich blood to the heart muscle. And that's what we really want to make sure we do in our cardiac population. So that's the warm-up. What about after you exercise? What about the cool down? Well, just like it's important to not surprise your heart with any very sudden activity, it's also important not to withdraw activity from your heart very suddenly as well. When you're doing your exercise prescription, if it's a walking prescription or any other activity that uses your legs, a great deal of extra blood is going down to those working muscles to actually get you to carry out the exercise like walking. If you stop that exercise suddenly, what will happen is those muscles are no longer contracting and relaxing. They're no longer helping pump the blood up to your heart and up to your head. And that's what they call blood pooling, and it can cause a number of concerns. It can result in angina. Okay? It can also increase the amount of arrhythmia or skip beats that you experience, also increase the odds of silent blood flow problems, and can cause dizziness and lightheadedness. So ensuring that you do a proper cardiovascular cool down will decrease the odds of all of this happening. How do we do a proper cardiovascular cool down? The same way you warm up. A warm-up implies gradually doing 5 minutes of slightly slower walking prior to your exercise. A cool-down implies when you finish your quicker exercise prescription rate, you should walk for a minimum of 5 minutes, slightly slower than usual. This gives your heart rate a chance to recover. This gives your blood pressure a chance to recover. Your rate of respiration and breathing will slow down a little bit, and it dramatically decreases the odds of any blood pooling happening in your lower extremities, in your legs. I'd also like to point out that a cardiovascular warm-up and cool-down is different from a musculoskeletal warm-up and cool-down. We talk about doing some stretching exercises before you do your exercise prescription. This is a great idea to increase the range of movement through your muscles, make your walk feel a little bit better, and potentially decrease the odds of any injuries, musculoskeletal injuries. The musculoskeletal warm-up does not replace the cardiovascular warm-up. Just because you've done some stretching doesn't mean that you can skip that 5 minutes of slow walking before. They do completely different things, and it's very important that everyone understand that. So in summary, it's very important that you do your cardiovascular warm-up. It's very simple. It entails 5 minutes of walking at a slightly slower pace than your usual exercise speed. Carry out your exercise prescription. Immediately when you finish your exercise prescription, we'd like you to check your exercising heart rates, checking it on your wrist or at your neck for a period of 10 seconds. While you're checking that pulse, it's usually a good idea to sway from your left leg to your right leg. That ensures that you're still using those leg muscles and decreases the risks of blood pooling. Once you finish checking your pulse for 10 seconds, then we want you to carry out a 5-minute cool down, once again at a slightly slower pace than your usual walking speed, and then if you'd like to do some stretching exercises after that, that would be fantastic. Thank you.